So in this particular cow here, what we've got a solar ulcer, which commonly occurs in the outer claw, as in this case. And what Dave has done here, he's followed the five-step Dutch foot trimming method, which is always the approach for any lesion. He's now got to the stage where he's doing some remedial trimming, so this would be step 5. And in a minute he will put a block on the other claw to take the weight off that particular lesion. This lesion would have started with a bit of sole bruising, which would have originated at calving, and is then exacerbated by other cow comfort issues such as extending standing times, being on concrete, and these sort of things. And if this is the lesion that predominates, then we need to address any other cow comfort issues on the farm. So here Dave is preparing the inner claw here to put a block on. So this will take the weight off the outer claw, and is probably one of the best things for providing pain relief, but also to take the weight off that outer claw to maximise the chance of this cow healing. It is important that the faster that you can treat these lesions, the better the response. So in effect, if we can get to these lesions before they become severe, then we've got a much better chance of getting a good cure. Hence why we will mobility score so regularly and then respond to that mobility score quickly. So this cow will have been mobility scored as a score 2 for the first time only the day before yesterday, and that's why this cow's been presented for foot trimming. She wasn't severely lame, but if that lesion had been left to go on any longer, then she would have been severely lame. This case of sole ulcer looks as though it's a fairly fresh case and one that doesn't look too complicated. However, we're seeing more and more cases now of sole ulcers and white line that are not responding to treatment or conventional treatment, and it's beginning to believe that the digital dermatitis organism, one of the treponemes, is actually invading these areas and is setting up an infection which is preventing the white line or the sole ulcer from healing correctly. And in that case, this cow might need a dose of antibiotics to actually help the healing process. However, for a sole ulcer and a white line lesion, we wouldn't routinely use antibiotics, but the other thing that should be considered in all cases of lameness is an anti-inflammatory pain-killing drug as well. We would suggest where possible that all cows are foot trimmed twice a year. A good time to doing one of those trims can be at drying off. The other time is probably at about 90 to 100 days into lactation, just to prevent for problems with sole ulcer and also white line disease. In most cases, all back feet are done. However, we would recommend that the front feet are also trimmed, but it is important that you have good quality equipment to be able to do that. Front feet are notoriously difficult to trim and to treat, but in this case the foot is reasonably well presented, and so the front feet can be done. But by doing this preventative foot trimming on the front feet, it does avoid problems